Well, let's switch gears from education to COVID. President Biden plans to end the national COVID emergency and public health emergency, two separate emergency declarations. And Illinois will be following suit as well and ending its disaster proclamation that was enacted back in March 2020. We all remember what was happening in March 2020. So, Maxwell, can you remind us what the state proclamation did?
I can't recall exactly, but I do know that some combination of city, state, and federal lockdown really put people into their homes for an extended period of time. That's when we were all really confused about whether we could ever go to the grocery store again, that kind of thing, ever go to a concert, things like that. So I remember those times well.
Washing all of our boxes.
Washing the fruits from the stores 15 different times in case somebody with COVID might have touched it because we were concerned about that. Not good times.
Yeah,
not good times.
Or walked past it. Lorraine, what do you make of the federal government ending the national COVID emergencies?
Well, I think it's a recognition of reality. I mean, people have largely returned to normal, going to restaurants, going to concerts, going to plays. Some of us are still wearing masks in public places. Vaccination overall has been good, except for the boosters. People are not getting their boosters in the numbers that they should. So I think that it's a recognition of reality that, things have returned to normal and we can't stay in a state of emergency forever. And, we've got it kind of under control, not fully, it's not going to go away. So
a couple of concerns, though. Folks with private insurance could face charges for lab tests, even if they're ordered by a provider. Vaccinations also will continue to be free for those with private insurance who go to in-network providers. But going to an out-of-network provider could incur some charges. Alden, I know that during the pandemic, you have had your eye very closely on COVID numbers, period. You're the data guy. But some of the disparities we saw, with more Black and Latino Chicagoans dying from COVID complications, et cetera. So your thoughts then on these changes?
I say that we certainly have moved out of the ultra emergencies, state of emergencies that we were in when COVID first encountered us, literally 3 years ago. The thing that concerns me, though, is that it's still a reality. And so as we are kind of moving back into normal life, it's those communities that are kind of more susceptible to when our guard is down, as it was in February and March of 2020. That's when those communities are hit the hardest. And so as we move on, and it'll be interesting to keep an eye on the numbers, that will still need to be something that we're deeply concerned about, the most vulnerable communities, that they have the protections that they need. And that's been the story all along, that as we were kind of coming in and out of our various states of kind of ultra protection, there were communities that were living a different experience with COVID than many others. And that's a fact that I think kind of got lost in the shuffle to some degree.